where they stood in the way even of Medicare. And we could say, you could blame us for the cause of not having a single-payer universal health care. But we're now here to say that that is changed. And the majority of physicians, the majority of nurses, the majority of health professionals are in favor of health care as a right, not a privilege, health care for all, health care that is affordable for all. And so these are the health professionals that came. There were actually more than 100 more that wanted to come but had to actually deliver health care. So they weren't able to come. So I think that's all I'm going to say. We're going to run through these as fast as we can as far as people are going to come up and just tell you what their view is as why they're here and why it's important for them to have a single-payer universal health care system. By the way, I am Deb Richter. I didn't even introduce myself. Thank you. Marvin Malek, I believe, are you here, Marvin? Yeah, Marvin wanted to speak next. And then we'll just have you line up and go through. Okay, good idea.
My white coat got stained yesterday, so I couldn't bring it. I'm sorry for that. I don't have my prop. I just wanted to thank everyone for coming. And I want to say that this is a very exciting moment for those of us who have been part of the struggle for a humane and decent healthcare system. This is a really exciting moment. We now have people in the political sector who seem to be motivated to get us to where we need to go. But one of the biggest things I want to say to the doctors in this audience is that this struggle is far from over. And I feel very strongly that if we enact a bill and it's labeled as single-payer universal health care, and it doesn't succeed in controlling costs, and it turns out to fall on its face over costs, that this will be a tremendous tragedy nationally. And I feel very strongly that we can do it here, we can get it right. We know that the costs that the U.S. healthcare system generates, administrative costs, excessive costs from drug companies, for pharmaceuticals, for medical supplies, they're not tenable. They're bankrupting the country, they're bankrupting as a state, us as a state, they're bankrupting our patients. This has got to change. And I feel very strongly that the physicians, nurse practitioners, people who treat patients, physician's assistants, mental health workers, I think we need to make sure that the legislators hear our input, because there are costs that we see every day at work that legislators who are not practicing clinicians are not going to see. So I want to say in the strongest terms, please, doctors, nurse practitioners, please make yourselves available to the legislature to tell them about all of what goes on in our practices that not only bring us here so that we can create a humane healthcare system, but also one that can be affordable. And Deb asked all of us who are speaking to give examples of patients who have been affected by the healthcare system and who have motivated us to come here today and work for universal healthcare. And I have a not very exciting example. I had a patient, there are many like this. In primary care, what we've seen over the last 10 years is a real denigration in how our time is spent due to the insurance sector and what insurance companies have done. Specifically, the biggest thing that has happened to the insurance sector, a consequence of us leaving control over the healthcare system to the insurance companies, is the creation of high deductible plans. And every primary care practitioner here knows this. They know that they end up spending time negotiating with patients. So my story is just a little itty-bitty story about one such patient. This fellow had diabetes. He was insured through his wife's high deductible plan. And every time he would come in, I would say to him, you haven't seen an ophthalmologist in 5.5 years. The next year, it would be 6.5 years. The next year, even 7.5. And he said, every single time, he said to me, no, I can't afford it, I can't afford it. You don't understand. Your income's probably higher. You don't understand what it is to really, really not be able to afford something. So finally one year, I managed to persuade him to go, and the visit turned out to be normal. Now all of us who are doctors know that this is a statistical phenomenon. If you send 100 diabetic patients like him to the eye doctor, you know that 2 or 3 of them will have their vision saved. But he wasn't one of those. So he came back, and I won't use in mixed company, polite company, what he said to me. And now he had a big bill, and it was another extra $150 that his family didn't have. And I would like a healthcare system where if I'm providing decent health care, I don't have to bankrupt patients, I don't have to listen to that over and over again about people who can't afford basic health care, basic decency. We, as doctors, as patients, as a state, need to take control over our healthcare system back.
Thank you,
And
Marvin.
that's my message. Thank you all very much.
Okay.